The healthcare industry in the United States is a very strange animal. Healthcare in the United States has a bunch of different factors that seem to be working against each other. So first of all, the medical technology in the United States is very advanced. We have the best diagnostic equipment and laboratories in the world in general, the best surgical equipment, the best surgical technology of most any place in the world. We have medical care at the end of life that is superior to most everything else in the world. When famous or important people around the world need a special surgery or a special kind of medical technology, they often come to the United States. However, the United States has never invested nearly as much in things like preventive care and child care. If we put just a small percentage of our medical technology budget into preventive care and encouraging and supporting people to go get preventive care and regular checkups and take their blood pressure medications, things like that, it would dramatically reduce the overall cost of healthcare because we would be preventing people from needing those super expensive, specialized surgeries and end-of-life care. Part of the problem with the healthcare industry in the United States is that the healthcare companies are run for profit, not for the benefit of the patients. And the payment for the healthcare is run by the for-profit insurance companies, which also run for a profit, not for the patient. So people pay massive amounts of their salary into healthcare insurance, hoping that they'll never need it. But then when they do need healthcare, they so often have to fight with their insurance company just to get the healthcare that their doctor has documented that they need. And throughout that entire process, there are people skimming off profits from the entire system that sometimes amount to more than the amount that's being paid for the health care. So in the United States, we still rank very low in our early childhood health care. We rank very low in our prenatal care, and this results in children that are born underweight with severe medical problems, which again cost huge amounts of money to treat, when they could have been prevented by just a couple of prenatal doctor visits. Now, in mental health care, we have an entire additional layer of problems. The payment scheme for mental health care in this country runs on two completely opposite ideas. If you have private insurance, it's very, very difficult in many cases to get good mental health care because the insurance companies don't want to pay for it, and they will do everything they can to discourage it because mental health care is difficult to predict exactly what this is going to cost, what it should cost, how many visits should be involved, etc. It's not near as easy for the insurance company to calculate what this treatment should cost, and therefore they just don't want to get into it at all. If you are relying on public health care for your mental health care, there's an entirely different system. The public mental health care system is really very wide, very vast, but there are so many people clamoring to get help through that system that it can take forever to get an appointment and get the help that you need. It can easily take 6 or 12 months just to get to the doctor who can actually provide the services that you need. You have to go through so many people in the public healthcare system to get authorized for this, to get evaluated for that, to get referred to this program. And trying to get to the correct therapist or the correct doctor can take way too long, and people just quit trying. Then we have the additional problem that some of the employees who work for the public health system become lazy. They become dependent on the bureaucracy, and they can find ways, even unconsciously, to avoid doing the work that the patient needs. An additional problem in the public mental health care system is that the history of the public health care system has led to it being run by social workers who in many cases are not adequately trained psychotherapists. And the social workers are deciding how many physicians should be hired and how much work those physicians should do. And they try to determine which physicians are doing good work, but those social workers have never been a physician and don't know what's involved. In the United States, the public mental health system before around 1960 was simply a large network of state-run psychiatric hospitals for the most severely mentally ill. There was essentially no public mental health care treatment for people who did not need to be locked in psychiatric hospitals for long periods of time. Then starting in the early 1960s in most places around the country, well-meaning social workers started opening up county mental health care clinics that were designed for counseling and psychotherapy. But those social worker therapists really had no training or experience with any of the more severe mental illnesses. In many cases, those social workers had been indoctrinated into a ideology that suggested there were no such serious mental disorders and that psychiatric medications were always bad. When the state psychiatric hospitals started closing many of their beds and returning the psychiatric patients to the communities, the social workers at these county mental health clinics thought that they were going to be fine with accepting these patients with severe mental illnesses, because in many cases these social workers didn't even believe those illnesses exist. Once those patients actually got to the county mental health clinics, the social workers found themselves overwhelmed and realized some of their patients will need medications, but the social workers had been indoctrinated to dislike the whole idea of psychiatrists and medicines, and so they were hiring doctors, but with a constant tension that the social workers didn't want these doctors to be there, and in many cases, those psychiatrists did not have much training or interest in the counseling and therapy that the social workers were doing. So here we are, 60 years later, with county mental health clinics all over the country providing thousands and thousands and thousands of hours of psychiatrist time trying to get medications to these patients. But the social workers who run the agency don't understand anything about those medications, don't understand what's involved in the diagnosis and prescription of medications. And so they simply want doctors who will come in and write prescriptions, but they don't really know or care to know what makes a good public health psychiatrist and which psychiatrists are just being lazy and handing out pills without really bothering to know the patients. So in addition to all of the problems in the healthcare system in the United States, in addition to all the other layers of problems, the public mental health system has these additional political problems between the psychiatrists who are providing the vast majority of the treatment in these public mental health clinics and the social workers who run the clinics and the agencies without knowing anything about what makes for a good psychiatrist and what's a bad psychiatrist.